Hi, I'm Dr. Fatima Larry, and today we're going to go through a critical body system. So understanding the anatomy and physiology of your body and how the various systems and members work together will help you understand the interactions between medicinal herbs and their impacts on various parts of the body. Today, I'm going to be providing an overview of the digestive system, and it's also referred to as the gastrointestinal system. This overview will help to prepare us for a more detailed presentation later. So what is the digestive system? These are some of the questions. Why is it important? How does it work? And what does the gastrointestinal system do? What types of cells, tissues, and organs that allow this system to do its job? And how does it all function together? And why is it important for my body? This series is going to help us to understand and gain a better understanding of how food is broken down, nutrients are absorbed, fluid balance, and solid waste elimination. The digestive system controls the appetite, secretes digestive enzymes, and moves food through what's called your digestive tract. So the digestive system is composed of 1, the long digestive tract, and this has also been called the alimentary canal. 2, associated organs, such as the liver, gallbladder, and pancreas. There are also several glands that are necessary for producing digestive juices and glands necessary for nutrient processing. So now it's important to keep in mind and note that the endocrine system works in conjunction with the digestive system in order for the digestive system to function properly. Meaning the two systems, the digestive system and the endocrine system, work together. And if you have issues with one or the other, they can actually impact how either or functions. So therefore, throughout the series, I'll be mentioning periodically the endocrine system, because you need to understand that system as well. And at the most basic level, we're not going to go into a lot of details, but we'll need to know what is a gland, what types of cells, organs, secretion products, as well as message signals. These are all important for the digestive system to operate properly. In addition, there are specific hormones and secretions that help regulate multiple body functions that are tied to the digestive system. And this goes far beyond just simply digesting your food. So think about your growth, your metabolism, and energy use. So let's jump into a question that I want you to think about. Did you know that before you even eat food, so before food even enters into your mouth, your body begins to prepare for its digestion? So I want you to think about that throughout this series. So we're going to begin at the digestive tract, and we'll start there. It's a long tract, and consider it like a pathway, a canal, or even just think of like a physical tube, okay? And it starts at the mouth and it ends at your anus. Keeping in mind there are openings at both ends. So if we're thinking about this tube, this canal, this pathway channel, where your food is going to pass through the body. So I'm going to list some places your food is going to hit. Okay, so starting at the mouth, then it's going to go through the esophagus, into the stomach, your small intestine, and your large intestine. And it's going to go through your rectum and out of your anus. And this is where your feces is going to come out. So within each of these parts, you can further break it down into more detail. We're not going to get into that today, but think about your mouth has your teeth, your tongue, your saliva. So before your food can even enter into your esophagus, it has to go through your pharynx. And then consider the fact that you have, of course, your stomach and the various components of your small intestine and your large intestine, and of course it will go through your anus. So the digestive system is highly complex, and it's actually uniquely designed because in addition to everything that I've mentioned, it also regulates your fluid system and balance, and this includes absorption and hydration, as well as your digestive system plays a key role in the function of your immune system. So if you remember, I have some previous videos about the fluid system and balance and the immune system being the defense and protection system. So This is all important. As I mentioned, the digestive system has a major role in breaking down your food, extracting and absorbing nutrients, and extracting and eliminating waste products. And so these waste products can be food or non-food products. So consider the fact that if you're taking suppression drug medications, any undigested medication is actually going to be eliminated through your digestive system. In addition, there are medicinal herbs that also are utilized through the process of your digestive system breaking them down, and there are medicinal herbs that actually will target your gut health. So why is all of this important? So as I mentioned, nutrients are absorbed, and that's a major role for the digestive system. And also consider the fact that the digestive system is your body's natural detoxification and elimination system. And so I know we talked about the fluid system, the blood system, and balance and getting rid of waste and toxins and things of that nature through your blood. But the digestive system plays a huge role in elimination of toxic products, including suppression drug medications and toxins that you may take in through your food and things of that sort. So the digestive system uses two processes to break down your food. You have the mechanical and chemical processing. So mechanical is your actual physical chewing of your food, and the chemical process, just think of that as your body's own natural secretions and enzymes that help you break down food so that you can optimize and extract the most nutrients out of your food, and that can be absorbed. And then these enzymes and secretions help you further digest and eliminate waste. Okay, so all of this is done, as I mentioned, within this digestive tract. So from your mouth down to your anus, there's a continual process that your food goes through. All right, so your mouth is responsible for the majority of the mechanical breakdown of your food. So think of your teeth, tongue, and saliva, as I mentioned. And so this is where your food is going to get broken down, and it's going to get simplified into things like carbohydrates or your simple sugars. All right, the purpose is to ensure you have an immediate energy source while your food continues to be broken down, and there is more difficult stages where your food has to actually break down pieces of, say, protein and fats. And all of this is going to be done through different parts of your digestive system. And then you have in your stomach those digestive enzymes, and it can further break down, as I mentioned, those more complex pieces of food. And next, you want to think about your small intestine. And so your small intestine is really important for nutrient, mineral, and vitamin absorption. So now, think about all of this together. So if you're taking suppression drug medications, sometimes you can have some interferences, some blockings, and some alterations of your body's ability to digest and metabolize food properly, as well as hindrances with nutrient absorption. And all of this can actually, say if you're taking suppression drug medications, it may slow down or speed up your digestion, and you can have weight loss or weight gain. And that's specific for individuals and the medications that they might be taking. In addition, consider that medicinal herbs also interact with your digestive system, and we'll get into talking about that a bit more later. So, I want to also talk about some gastrointestinal disorders. So you can have some issues within your digestive system, and this can be along any aspect of the tract that I spoke about. Remember, your food is traveling along this pathway from your mouth all the way to your anus, and you can have various issues at any point in that digestive system. So some gastrointestinal disorders may include things like irritable bowel syndrome. Okay, so this can cause abdominal pain, gas, bloating, diarrhea, constipation. Also, you may have some inflammatory bowel disorders or diseases, and this can cause chronic inflammation anywhere within your digestive tract. And these issues can cause problem with your food digestion, your nutrient absorption, as well as waste elimination. So there are various types of illnesses as well that are impacting the digestive system. So they may not be directly in the digestive tract, but they impact this system, your GI system as a whole. And this can be type 2 diabetes, high blood pressure, obesity, what's called gastroesophageal reflux disease. So you might hear it as GERD, G-E-R-D, or it may be more simplified as, say, like acid reflux. And so these types of illnesses can cause damage to your stomach and to your esophagus, and they can cause extreme heartburn and regurgitation. So these all impact your gastrointestinal system, as well as the various organs, tissues, and cells that all have to work in order for your food to be properly digested. So in our next video, we're going to go into this system and we're going to truly understand, not according to man's understanding or some false understanding, but we're going to carefully look at the design of this critical system to better understand the food and non-food impacts on the digestive system. And we're also going to take a look at different types of medicinal herbs and holistic health and wellness options available to ensure safe and proper use for the body. So hopefully this will help you determine which choices are the most beneficial for you and your body. And so this is the digestive and gastrointestinal system part 1, digestion, absorption, and waste removal system, medicinal herbs. And we're going to carefully explore this vital system, the digestive tract, and how it is all connected to your overall health and wellness. So hopefully you'll gain a better understanding and you can learn about medicinal herbal writing in a way that is clean, safe, and true. For medicinal, herbal, and natural holistic health and wellness, I'm Dr. Fatima Larry, and thank you for tuning in.